Hi, thank you so much for having me on your podcast, bringing me in as a specialist about sickle cell anemia. My name is Brittany. It's very nice to meet you.
Yeah, thank you for coming. So my name is Quentin, and I'm an occupational therapy student, and I'm just going to be talking some about how we treat our clients in the pediatric population who have sickle cell anemia, but I don't know all the details that you know. So could you tell us a little bit about sickle cell anemia?
Absolutely, yes. So, sickle cell anemia is disfiguration of those red blood cells. So, normally, what your red blood cells look like, they're disc shaped. They're pretty flexible. They'll carry oxygen to your organs. Very
Hmm.
important. But sickle cell anemia is actually a disfigurement of them. So, the cell itself disforms. It looks like a sickle shape, hence the name. Or I can describe it maybe as like a banana shape or has a very large concave in it.
Okay.
And because of this, they're not as flexible. So they could get occluded in your bloodstream and cause other problems, pain. There's two different things that's important to keep in mind here. So there's sickle cell disease and sickle cell anemia.
Okay.
Sickle cell disease is meaning that you are a carrier of it, right?
Hmm.
But sickle cell anemia is the actual outward expression. So you are actively having those red blood cells sickle, versus sickle cell disease, again, just means you're carrying the trait.
Okay, yeah, that makes sense. Thanks for telling me about that.
Mhm.
Okay, yeah, so now could you just tell me a little bit about how this presents in children and some symptoms you might start to see?
Yeah, absolutely. So when baby is born with fetal hemoglobin.
Okay.
So they have that fetal hemoglobin probably until maybe 4 to 6 months, and then you'll start seeing it being replaced with the adult hemoglobin. So you really aren't seeing that sickle cell anemia symptom until they are hitting that age. That's when they have the full-blown expression if they have both of the genes. So, some early symptoms that you might see is swelling of the hands and feet, or excessive fussiness, but that's pretty much the extent that you'll see up until that age.
Okay.
Now, once you're really getting into those 5, 6 month range, you'll start seeing jaundice, which is a yellowish color of the skin. You could see excessive tiredness or fussiness, which is very often because, again, parts of the body are not getting the oxygen that it needs, would affect a
Right.
lot of things, or also, again, painful swelling of the hands and feet. But some long-term symptoms for these children would include frequent infections or fatigue or strokes from the buildup of those red blood cells, delayed growth, and even a shorter life expectancy.
Okay, yeah, thank you for telling me about
Of
that.
course.
Okay, now would you mind telling me a few things you think I ought to know about sickle cell anemia since I'll be treating some kids with it?
Yeah, absolutely. So, even if we think about the cause of sickle cell anemia, I kind of touched on it a little bit already, but it's going to be having two of the same trait, which is the sickle cell disease trait, in the child is what's going to make that outward expression.
Okay.
So, if the child doesn't have both traits, they're not going to actively have sickle cell anemia. They're just going to have and be a carrier of the sickle cell disease. And if we're going a little bit more into other things as well, the prevalence goes 1 in 13 African Americans are a sickle cell trait carrier, but do not know that they have it. 100,000 Americans have sickle cell disease, and 2,000 babies are born with sickle cell disease in the US, which is, quite the statistic.
Yeah.
And just again, to reiterate, let's say if I had sickle cell disease or sickle cell anemia, it's not possible for me to give it to you. It's not something that's contagious.
Right.
It's something that's inherited.
Okay, yeah, thank you.
So, as an occupational therapy student, how would you view a child that has sickle cell anemia?
Okay, yeah. So we can look at a child with sickle cell anemia and think about their strengths and weaknesses, which are called their client factors. And so their mental functions are a big one. They have things like cognition and their personality and intelligence. All of those are fully intact in a child with sickle cell anemia, but they may have some other mental health concerns, such as like depression and anxiety. And a lot of this has to do with them just feeling fatigued and tired all the time because the sickle cell anemia really takes a toll on your energy levels and just your ability to function throughout your day as you might like to. And so then your mobility could also be affected, but this would be more in the sense of you would just be too tired to have that same level of mobility that you would like to have. And then things like your sensory functions, your voice, your speech, all of those things are fully intact and a strength for people with sickle cell anemia. And then another weakness would just be maybe things like respiratory and cardiovascular things like
Right.
that. A lot of these people get like frequent infections and they might have to have frequent hospital visits. And so a lot of things like that can affect their mobility and their mental health, like I mentioned.
Makes sense. Thank you.
Yeah.
So tell me about how their routines would be affected.
Yeah, so that's a big thing in OT. Those are our performance patterns. And so those are things like routines, roles, and rituals, and just things that these kids like to do on a daily basis. And so their routines can be heavily impacted by them having to go to frequent doctor appointments, hospital visits, them being sick often. Just all those things would impact their daily routines as well as their daily roles. Like if they're a sibling and a child and a student, maybe like they're at school or at work, like whatever those roles are, if you're getting sick all the time, those things are going to be affected a lot. However, you do have a lot of positive things with your performance patterns because you can still have a regular routine. You just might have to modify some things to account for that feeling of extra fatigue and extra tiredness that you might feel throughout your day.
Makes sense. So tell me about how it affects things that a child might want to do, need to do, or expected to do.
Yeah, so in occupational therapy, we call those your occupations. And so some things that might be affected for a child with sickle cell anemia would be your ADLs and IADLs, which stand for your activities of daily living and your instrumental activities of daily living. And so for your ADLs, things like dressing, getting ready in the morning, your joint mobility, all that stuff would be hard. If you were like super fatigued or you had a lot of pain, just all of those things would be a lot harder. And then for IADLs, if you were taking care of others, taking care of pets, trying to fix your food, just everything's going to be a lot harder if you're just not feeling well overall.
Right.
And then depending on your age, like you might have a job, so you might try to go to work every day. But if you're having frequent like doctor appointments and hospital visits, it's going to be a lot harder to keep that work schedule up. And then education is not another important occupation. And so if you're unable to go to school every day, that's going to really start affecting your education. And then social participation is another occupation that'll be affected. And so even if you have that desire to go hang out with your friends and family, you just might not feel up to it that day, which really ties into that mental health aspect where if you're not feeling up to hanging out with people every time you want to, that's going to affect your mental health. And then just health management, being able to like manage your medicines, your doctor appointments, things like that. So there's a lot of things in your daily life that'll be affected if you have sickle cell anemia.
Makes sense. Thank you.
Yeah.
Okay, yeah. Thank you for that. Can you tell me a little bit about like when you have a child coming into your clinic, like what does that look like for them?
Yeah, so when a child first walks in, one of the first things we'll do is an evaluation with the child. And so we're just evaluating them to see where they're at, to see what their strengths and weaknesses are. And so for a child with sickle cell anemia, we might be focusing on their sustained attention and how well they're able to execute their daily life and their daily functioning, and just kind of see where that child falls with their abilities on that day. And then we'd start looking at interventions and just trying to see how we would be able to help them get through their daily routines and roles in a more functional and better way that would make their just everyday life easier. So,
That
yeah.
makes total sense. Well, thank you so much for having me on your podcast. I
Yeah,
learned so
thank you
much
for
about
coming.
occupational therapy. Until
Yeah,
next time,
thank you for
yes.
telling us about sickle cell anemia.